Turn 2-5 on your health tonight and avoiding flare-ups from a chronic and painful skin disease. Here with advice is Dr. Abby Waldman, a dermatologist at Brigham and Women's Hospital. It's great to see you, doctor. Thanks for your time. So, a large number, more than 8 million Americans currently have psoriasis. So, this may be a simple question, but how is it diagnosed?
So psoriasis usually presents as pink plaques that have a typical white or silver scale on them. It really can show up anywhere on the body, but it is most common on the elbows, on the knees, on the scalp, and even in between the bottom. Now, most of the time, the diagnosis is either made by a doctor, or if you sort of know that you have family members with it, you might self-diagnose. It is best to get input from a dermatologist. Many people think of it as really just a skin condition, but it actually can go along with lots of other inflammatory symptoms, and that can be joint pain, joint swelling. It can even be an increased risk of heart disease and stroke. So it's really important to get your doctor involved and have them manage those symptoms so that you can prevent any of those type of inflammatory issues.
Right, and doctor, there's no cure for psoriasis, but is there anything that people can do to treat it? Is it a red light therapy? Is it a cream? Is it a pill? What can they do?
Kind of all of the above. So for very sort of basic treatments, it's usually topical treatments, steroids, topical vitamin D, and then light therapy. So not necessarily red light therapy, but actually UV. The one dermatologists are usually telling you to stay away from actually can help some people with psoriasis. We like to do it in a controlled setting in a doctor office. It's called narrowband UVB. But even a little bit of controlled light out in the summer can actually help some people with psoriasis. And then for more severe disease, there are oral medicines, there are biologics that go by a shot that can help reduce inflammation.
And doctor, we're always learning, right? We're always moving the ball forward. So there's new research suggesting a link between flare-ups and eating ultra-processed foods. What can you tell us about that? Is there a connection?
There is, yeah. I think more and more research is coming out about this, but essentially the study showed that patients with active psoriasis had a more likely to have a diet high in ultra-processed foods, and that's like sugar and soda and processed pizza and things like that. So we don't really know if cutting those out will improve your psoriasis, but some data suggest that a Mediterranean diet, a healthy diet, can improve inflammatory symptoms.
Doctor, we appreciate your wisdom and your expertise. Thanks for joining us.
Thank you, doctor.
Thank you for having me.
Take care.
You too. Take care.
The snow